Welcome to the Health Matters program produced by the Ministry of Health. I'm your host, Alicia Martin. As we observe Diabetes Awareness Month, today we'll be talking about diabetes treatment and prevention. Joining me on the program is Dr. Nandishaw Ramsingh, Technical Officer for Diabetes and Kidney Care. Welcome to the program, Dr. Ramsingh.
Thank you so much, Alicia. It's always a pleasure to be here.
So we're observing Diabetes Awareness Month this November. Tell us a little bit about what this means for Guyana and the team this year.
So, Alicia, Diabetes Awareness Month is very close to my heart. Obviously, I am the diabetes officer here at Ministry of Health. And this month, we're actually focusing around the theme, which is diabetes and well-being. Mm-hmm. And for the month, it's diabetes across all stages. So we're not just focusing on adults solely or on children solely. We want to make sure that we capture adults, children, teens, because a lot of times person thinks that diabetes is an old people disease.
When we get older.
Yes, like only when I get old I can get this thing named diabetes or sugar. That's like the most popular term we use here. When I get old I can get this thing called sugar. But no, we want persons to know that diabetes affects the young, the old, and even the middle. So this month, we really want to focus on promotion. We want all of our regions, but we have all of our regions that will be doing promotional activities, screening activities, because screening is so very big when it comes to diabetes or the conditions that fall through under diabetes. So we really want persons to get a little bit more engaged when they go to their health centers and their hospitals, to like ask questions, don't be afraid, don't be shy. Even in your clinics when you're waiting, talk to other patients that are there so you can be able to share the knowledge, because I might know about screening, you might not.
Correct.
And I can be able to know about this thing we call HbA1c testing, or this other testing we call RBS testing, so that we can be able to share the knowledge too. Sharing is caring, so why not share the knowledge?
Indeed. When we think about, or when we talk about diabetes, what does this mean? What is diabetes?
So diabetes is a chronic disease, meaning it's a long-lasting disease. We don't have any cure for diabetes, but what we have is control. So basically what happens is that we eat a lot of foods. In those foods, there are glucoses. But for some persons, their cells aren't able to break down that glucose as, a normal person would be able to. And when that happens, our cells are affected. Hence, our pancreas isn't able to produce this hormone we call insulin, which can help to break down this glucose, and hence we have these persons being classed as diabetics, type 1 and type 2. Our type 1 are mostly in children, and our type 2 are mostly the older adults. I'm not sure if persons would know, but there is a new term of pre-diabetes now.
Yes.
Now, pre-diabetes is basically where, you have a very strong family history of diabetes. We ask those persons, especially it happens in the teenager age, to at least access a health center, a hospital, or a lab to get the HbA1c test done, which is a blood test that shows us the ranges of your sugar over the last 3 months. Now, once we're able to see your blood sugar range, we're able to determine if you're a pre-diabetic or not. So usually this range is between 5.7 to 6.4%, because the test or the lab test, it's done in percentage format, which is the HbA1c test. So we get to see those percentage. We look at your lifestyle, we look at your family history, and we're able to modify your lifestyle. And this is the only type of diabetes that is reversible. Hence, you have a chance from moving from a pre-diabetes to a normal person instead of developing type 2 diabetes. And it's all based on your lifestyle and exercise.
Indeed. You mentioned type 2 diabetes. Tell us a little bit about that.
So type 2 diabetes, like I said, it's occurring mostly in the older patients. We find that a lot of patients, genetic-wise, this is based on genetics. It's based on also your lifestyle changes that persons don't like to do, because I know our culture we're very strict in how we eat our rice and our flour. A lot of times we think that exercise is not something that we need to do because we're doing housework or
And
we're
that's
doing
exercise.
exactly. And we consider that as exercise. And we forget that we really need something that's constant, that keeps the
Yes.
heart beating. So when we talk about type 2 diabetes, we're actually talking about persons who have this in their genes. It's genetic, it's in the family for years and years and ages.
Okay, you mentioned the importance of exercise. What
Yeah.
can persons do to ensure they're able to do this every day and make it a part of their lifestyle?
Of the routine. So first things first, it's always mind over matter for me. So you have to want to do exercise, or you want to start somewhere where you can be able to see that, progress in getting you to the goal that you want. And exercising for us is 5 days a week, 30 minutes a day. Now, we don't want you to go in the gym, throw down on this treadmill and give me a 30 minutes because you think cardio is going to do it alone. There's so many other forms, and you can start from even the basic. Walking by itself for 30 minutes a day is a very good form of exercise. Persons who don't want to run, they can walk. If you're a runner or you like running, no problem. You want to use your bicycle, that's even fine. Is there other extracurricular activities like swimming, riding? Persons have developed so many different routines to add to their, daily composite of work that they have. Some persons have even developed the habit of taking an hour, their lunch hour, they will go to gym. They will do some form of exercise, and they come back to work just so that they can be able to stay active throughout the day. So exercise for me is very important. Please, no housework. We really want to get the constant beats of the
Yes.
heart. The heart must be pumping. So we recommend the running, the walking. Now, there are a lot of other exercises such as Pilates, aerobics. You can be able to do those if you don't want to do the running or walking. And it will be able to help you meet your fitness goal, because the idea is to be fit and healthy.
Indeed. Thank you, Dr. Ramsingh. We're going to go into a short break and be right back.
Exercise in your 40s seems trivial, but you need it now more than ever. The body starts to decline after 30, and that decline gets more aggressive every year. But exercise slows that decline, helping you prevent some common health conditions. To stay happy, healthy, and looking as great as you feel in your 40s, try these. To prevent heart disease, try cardiovascular workouts. It's a heart-pumping exercise that will keep your heart muscles strong. Ward off osteoporosis by adding a light jog into your walking workout to keep your bones strong. To fight arthritis, even in its tracks, strength training has been proven to decrease joint pains. Women between ages 45 and 64 have an increased risk of depression, and yoga reduces stress and regulates mood. Back pain becomes common as we get older, so try holding a basic plank for 90 seconds. Life's a little sweeter over 40. Eat well, keep moving. A message from the Chronic Disease Unit of the Ministry of Health. Exercise gives you more than just a great body. Some benefits you can't see, but you can feel. Cardio increases your heart rate and improves circulation. 60 minutes is good for heart health and 30 minutes for overall health. It helps boost your immune system, eases your mind, and rejuvenates your body. Now let's talk muscle. The more muscle mass you have, the more fat your body burns while resting. A pound of muscle burns 3 times more calories than a pound of fat. So having more muscle means you can consume more calories. Exercise can improve the look of your skin, boosts your self-confidence, and helps you sleep better so you can wake up and do it all over again. 30 consecutive minutes per day, 5 days a week. Start now. Eat well, keep moving. A message from the Chronic Disease Unit of the Ministry of Health. What does a healthy plate look like? It's made up of whole grains, healthy protein, vegetables, and fruits. Let's start with whole grains. Eat a variety of whole grains like whole wheat bread, whole grain pasta, and brown rice. Avoid those refined grains like white rice and white bread. Healthy protein. Choose fish, poultry, beans, and nuts, limiting red meat, cheese, and avoiding processed meats like bacon. Fruits and vegetables. Eat a variety of fruits and more green and other colored vegetables daily. They provide a variety of nutrients, antioxidants, and fiber, which build the immune system, prevent obesity, and promote healthy, youthful skin. Use more organic seasonings and less salty products like aji cubes and packet or bottled seasonings when preparing meals. And lastly, stay hydrated. Drink at least 8 cups or pints of water daily. Tea and natural fruit juices are great options. Avoid sugary foods and sweetened beverages. Eat well, keep moving. A message from the Ministry of Health Chronic Disease Unit.
Dr. Ramsingh, tell us a little bit about the signs and symptoms of diabetes. I know a lot of persons would have had diabetes and they didn't know they had it until they started to see different symptoms and signs and then try to find out what it is. So tell us about that.
Yeah, exactly. So basically, let's look at type 1 diabetes, especially because I know a lot of parents would probably be concerned. Now, one of the signs we look at, and we usually urge parents, to if you see this in your kids, make sure you get to the health center or get to your pediatrician. If you find that your kids, kids usually stop wetting the bed like around 4 years old or so. If you find that like at 6 years, 5 years, they're just suddenly start wetting the bed, they start going to the washroom like very frequently, then you know that is a sign, and that's one of the signs that we usually look for in kids, that they may be a type 1 diabetic, and you should access your nearest health facility to be able to, have a pediatrician see them, let them be able to do a HbA1c test. So that's first things first for type 1. Now, usually in diabetes patients or persons who are probably on the verge of developing, diabetes, or they probably have these symptoms and they don't know, persons would usually complain, oh, doc, nurse, I'm feeling very thirsty, like I'm drinking a lot of water. That's one of the number one signs. I'm going to the washroom very late at night because I'm getting up all these weird hours and I'm just going to the washroom to urinate. That's another sign. So those are the two most frequent signs that we see. Weight loss is also one. Persons tend to lose a bit more weight, and they're eating a lot. So that doesn't correlate. So how is it that I'm so hungry? I'm eating a lot, but I'm losing weight. That's a sign that you should probably go and check your doctor or health facility to see what's going on. One of the least common, it's itching of the skin. So we would find patients complain that, oh, doc, nurse, my feet, I'm feeling a lot of itching in my lower limbs. So those are the signs we typically look for when someone is probably being diagnosed with diabetes, or let's say you're at home and a family member complains about that. It should raise an alarm in the mind that, hey, maybe this person is diabetic. And especially if they have family history of it, don't take the chance to just stay at home, especially men. Men like to stay at home. They don't like to access the health centers and health. That's fine. But let's look at it from a news perspective that, hey, want to be healthy, want to be fit, want to know, these signs and symptoms are related to diabetes, because diabetes, it's a very complex disease. It has many complications. Two of the main ones, or we should say 3 of the main ones, is kidney failure, because a lot of persons develop kidney disease, and if it's not treated or if it's not detected early enough, it leads to kidney failure. So that's why we have a lot of our patients on dialysis. There is diabetic foot complications, and as you would know, Alicia, there are a lot of persons who are amputated because they have diabetic foot complication and they weren't able to have proper care or family support for that. And we also have, and persons may not know, diabetes can actually lead to blindness as well.
Let's talk a little bit about the diabetic clinics that we have here in Guyana and how persons can be able to access those services available.
Okay, so each health facility that we have, health center, which is in all of the 10 regions, they provide what we call chronic disease clinics. At these chronic disease clinics, we see our hypertensive patients, our diabetic patient, and any other chronic illnesses that you may have. So how do you access the service? Now, let's say you're a newly diagnosed diabetic. We would usually have you go to your nearest health center, which is in your area, because we like to ensure that the community, they're seen together, they can be able to build that support within their community, and they also build that kind of confidentiality and familiarity with the doctor and nurses that they're seeing. So let's say a doctor sees you from the East Coast, but you're living in Campbellville. We have Campbellville Health Center, for example. You can be able to go with a referral, so the doctor or the healthcare worker from the facility that first saw you, or even if it's a private facility, they can be able to give you a referral, and you can be able to take that to your nearest health center and join that clinic. So that you can be able to have regular visits, and get your medication, get your laboratory, your blood test done, and so forth that's needed for your chronic disease care.
Let's talk a little bit about screening and how can this be done. Tell us about the different screening options available.
Okay, so when we talk about screening, we're basically looking at the tests that we can do or the blood tests we can do to, see what our sugar levels are like, see if we're a diabetic or not, or how we can start at our diagnosis. So we have two we usually use, which is the random blood sugar testing and the HbA1c testing. A lot of persons would know about the random blood sugar testing because that's been in our system for years.
Yes.
But, our minister and government have been able to introduce the newer, or we should say the gold standard of testing, which is the HbA1c testing. And this is actually available in our regions. They're at our regional hospitals, our new hospitals, and in some of our health centers. We have 82 facilities that have our portable HbA1c test. And this is the test that would tell you over a 3-month period the average of your blood sugars in the body, which is pretty accurate and it's pretty good. So we can be able to have that test available for all of our patients and for anyone who is seeking, to be screened,
Yes.
to know what their blood sugar level is, to know like, hey, am I a pre-diabetic? Am I normal? If I'm a diabetic, how high my sugar levels are. They can be able to access this screening too. And not to forget that we have our universal healthcare voucher that, we have offered there as one of the testing as the HbA1c test. So let's say, hey, this facility doesn't have the HbA1c machine. Then we can be able to use this voucher and ensure that we can be able to get an HbA1c test done. Our futuristic plan, which is already in the development, we have 82 sites, and the country has 358 health facilities, which are our health centers. And we do have in our long term to have each facility equipped with a HbA1c test machine.
Guyana is taking a bold step towards a healthier future. Introducing the Universal Health Voucher valued at $10,000 available to every citizen. This initiative by the government of Guyana gives you the opportunity to access early screening tests for non-communicable diseases like diabetes, hypertension, and cardiovascular conditions, with NCDs accounting for approximately 68% of all deaths in Guyana. Early detection is important. This program represents a $5 billion investment in the health and well-being of our nation, benefiting 500 people across the country. Eligible individuals include children from birth and adults 18 years and above. At the back of the voucher, you'll find a comprehensive list of tests available to you. To locate facilities where you can access these services, simply scan the QR code provided. This will direct you to a list of accredited healthcare providers. Don't hesitate. Visit your nearest health center to uplift your voucher and take charge of your health today.
Have you heard? The Ministry of Health has launched its cervical cancer screening voucher program for women aged 21 to 65. Eligible women can pick up their vouchers at any distribution site in their regions. Each voucher valued at $8,000 can be used at any of the health facilities listed on the back of the voucher. Cervical cancer caused by persistent HPV infection is the second leading cause of cancer-related deaths among women in Guyana. Early screening is crucial to detect and treat precancerous cells. Early detection saves lives. Ladies, don't hesitate to get screened for cervical cancer today. Your health matters. For more information about this program, call 227-4357 or visit the Ministry of Health's Facebook page.
The Ministry of Health has launched its eye testing and spectacles program. This initiative caters for anyone under 18 years of age and persons 50 years and older. Persons requiring an eye test can utilize a voucher valued at $2,000 at any of the opticals listed at the back of the voucher. If a patient requires spectacles, he or she can then uplift another voucher valued at $15,000 to cover the cost of the eyewear. Vouchers are available at various hospitals and health centers in your region. To learn more about this program, call 227-4357 or visit the Ministry of Health's Facebook page. Your eye health is important, so why wait? Get your eyes tested today. Your sight, our vision.
How can family members support their loved ones who may have diabetes?
So family support, peer support is very big and very needed, whether you're diabetic or whether hypertensive, whichever chronic disease you may have, family support is always needed and peer support. So how can I be able to support my family? For example, if they're a diabetic, one, ensure someone is there is able to go with them to their clinic visits. A lot of time, the elderly folks, they don't understand or they might not hear everything that the doctor or nurse have to say. So it's good if there is somebody to accompany them. I know everyone is working, but if we can make some time or if we can be able to have an hour or two to spend with them when they're going to their doctors, it will be good because sometimes there are updates in their blood tests or in their medication, and they might not fully understand what's needed or what's the next step. So one, we can support them by just being there.
Yes.
Two, a lot of times, as I said, diet and exercise is very important. For the elderly persons, they need someone to help them with their exercise. So if a family member can be able to do stretches with them, because they won't be able to do the running and the walking, but still get them in an active. Environment where you can, give them like a 10 minutes walk, then do some stretches with them. That's going to help them to
And it can
be a
be
little bit
something that
proactive.
is done right in the
Homes.
compound
Yep.
or.
Right at home, there are a lot of things that we can be able to use. Like I usually tell my patients too that, fill a little bag with sand, take the Caribbean little rice bag, put it on, you can put it on, your grandmother's foot, let her lift that. It helps to keep the muscles a bit in tone as well. So there are little things around the house that you can be able to do. I was explaining the other day to a patient that, hey, you can have, your grandfather hold the door and open it in and out. Because remember, we know they're not as agile as they were before, but you want them to be able to be a little bit more active. Now, for persons who may have amputee at home, you don't want the other limb because a lot of times one limb goes and then another limb, is amputated. So what do we look at? We look at family members to ensure that diabetics upkeep their diabetic foot care regimen.
Yes.
Help them to check their feet. Ensure that, they wear slippers or their sandals in the yard, no barefoot, in the yard. Let them wear white socks if they're walking around in the house. Why are they wearing the white socks? So that we can be able to see easily if they end up getting a nail bore or something prick them, the blood stain will be there. So it gives you an idea, hey, something just happened to the foot. But every single day, if someone can be able to check their feet for them, especially if they can't do it on their own, that's one big support because you're preventing that person from losing an entire limb.
Indeed.
Because a lot of times we receive a wound on our feet as a diabetic and we end up in the diabetic foot centers. The doctors there would try, but some are so infected that they can't be able to save that limb and it's amputated. And that's really big. So I find a lot, Alicia, that a lot of the support persons have to know how to support and just be there as well. Same thing with dieting. Persons probably won't think of it this way, but a diabetic diet is actually the perfect diet that a normal person should be following. And it's not that diabetics can't eat any and everything. It's how they need to eat it and in the portions that you need to eat it. And if all of us were to eat like a diabetic, we'll be one healthy nation too.
All right. How can community support help those who are diabetic?
Oh, community support can be really big and encouraging too. A lot of communities have schools attached to them. They have, the accessibility to visit the health centers. Now, what we can do as a community, visit your health centers, find out when there is like a chronic disease day. Chronic disease day usually have a lot of older folks come together and do something, for that health facility's chronic disease day. It can be very simple by doing short, exercises for them. Maybe there is a fitness group in the area because a lot of our communities are developed now. They have fitness group, dance groups, a lot of groups. You name it, we have it.
Indeed.
So why not take one of those afternoons whilst they're doing clinic like a lot of times they're just sitting there waiting to see the doctor. But let's say, hey, there is a dance group in this community. We can go and let the old people shake their hips a little bit by the time they're waiting, because it's all about community effort. And when you do see what you can do for chronic disease patients, it's always about enhancing their lifestyle changes.
Indeed.
And if it's by, hey, maybe there's a nutritionist or maybe there's a dietitian in the area that lives there, I can be able to give my time to the health facility, just visiting, because at the end of the day, these are the people who live in my community. How can I give back to them? They're older. They probably would have given in some way or the other. I can be able to do the same. I mean, we do it as healthcare workers. We go out, we have talks with the, chronic disease patients, and as a community, they can be able to do the same as well. For Diabetes Awareness Month, I hope persons are listening and they can be able to reach out to some of these facilities. They can reach out to us at Ministry of Health. We can be able to liaison with some of the health centers, and they can be able to do a talk, or even if they want to engage some of the elderly folks there to see how they can support them, that is fine too.
Thank you so much for joining me in the program today, Dr. Ramsingh. I want to say keep up the good work to you and your department.
Thank you so much, Alicia. As you know, it's always a pleasure being a part of this show.
Thank you for joining me in the program today. Do remember to stay tuned to the Ministry of Health's Facebook page for all of your health updates. I'm Host-Alicia Martin, saying goodbye for now.